everybody. It is an opportunity to look back together on the year 2022. When you're looking at the performance of an institute, one very easy and obvious starting point are the evaluations. The Luxembourg Institute of Health last year was evaluated by a Swiss company, Interface, and I'm happy to say that this was an in-depth evaluation, which has shown that not only the output but also the strategy and the outlook of the LIH is very positive. So a very good evaluation. Thank you everybody who has been contributing to that. However, there are also the key performance indicators. These are objective measures we are given by the ministry to assess on how we do. And again that is publications, quality of publications, funding secured. We have been able to achieve all of our KPIs. Again, thank you for all of you involved in achieving our goals. When we're looking at the actual scientific output, there are many papers, there's several hundred, and I cannot go into all of them. We are Translational Institute, and I use the chance to just highlight 3 of them. There is one, this is by the laboratory of Paghetti and Musai. Very interesting work looking at the master hijackers, uncovering on how leukemia disarms the body defense. They're microscopic vesicles who are actually able to tune down the immune response in cancer patients. Then here we have mesoconic acid. This is work by Dirk Brenner with German colleagues, which is an immunosuppressant that is actually synthesized by the body itself. Lots of applications we can think of here, not only during sepsis, but when immune reactions have to be suppressed, and by Meiser and colleagues showing on how certain metabolomes are actually instrumental in the spread of cancer cells during metastasis. There is also now an opportunity to look back at an earlier effort. You all know that the LIH has been very instrumental during the COVID pandemic. LST now can be looked at and we can assess the impact that we have created. The WHO has published in Nature the impact measured by excess mortality, and here I'm very, very happy to say that the lowest excess mortality during the COVID crisis in Europe is here in Luxembourg, probably not only in Europe but in the world. And we have now arguments and clear indicators that allow us to pinpoint our success here in Luxembourg to large-scale testing and tracing. Everybody who was involved, again, thank you very much for that. So we are not only looking back, but during the last year, 2 events, very importantly, have also paved the future, the translational future of the LIH. The Clinova initiative, the Clinova program, has been approved for funding here in Luxembourg, but that means that here is a multinational effort in order to develop precision medicine, notably in 3 large disease groups: multiple sclerosis, inflammatory bowel disease, and rheumatoid arthritis. We will be working together with our colleagues from France, Switzerland, and Germany to find out what is the right drug for the right patient. It's an artificial intelligence, data-driven endeavor where our neighboring countries are bringing in their own finances. And the last point to mention here is also a platform in Luxembourg to be better able to bring clinical trials to Luxembourg patients. That is the Forschungsklinik. It's a platform we have developed together with the CHL, but it is a platform that is available to all of the hospitals in Luxembourg. The Forschungsklinik is certainly a launchpad that allows us to start scientific projects that can immediately benefit Luxembourg patients. I would like to use the occasion and to thank everybody, of course the staffs who have done all the work, and our stakeholders, notably the ministries who are financing all of these efforts. Coming back with a positive evaluation, of course, is a wonderful way to thank you and to make sure that financing will be available to our efforts also in the future. Thank you.